Welcome back to Survival Dispatch. We're with Dr. Michael Fabian. We are at Volusia Top Gun again, and I've got my ear pro on. You can see the guys shooting behind us here. The topic of our discussion today is what we have in front of us, and I want to make sure I get this right. This is the EVERLIT Survival Emergency Advanced Trauma Kit. Now, Doc, when I look at this, I'm seeing IFAK, Individual First Aid Kit, because this is what mine looks like. It's in a little package like this. And so is that what this is? Is this an IFAK?
Yes. It's a nice compact kit that you can carry on your plate carrier. You can carry it on your go bag, or you can carry it when you go to the range. So it's a really good thing to have as a backup, and it's very compact. What we need to do is go through some of the items, and I'd like you to ask me about them as we go through so that our viewers out there can get a good idea of what's in this kit. There are 3 different colors here. They're the same contents, and this is their more deluxe kit, but you can get it in black, you can get it in camo, or you can get it in coyote.
So, cool. Well, I'm going to have a lot of questions. I'm going to try to kind of, keep it down to the important ones. So first off, what are the basic items that every individual first aid kit should have, and are they here?
What's important in here is there's some gauze, big gauze, there's tape, gloves, ACE wrap, and the CAT tourniquet, which is the tourniquet for extremity injuries, especially if you've got bleeding from whatever injury that you have. If you're hiking and you fall and you have a huge cut and you're having blood vessel bleeding, it's critical to save your life to be able to get out of there in time without significant blood loss. There's a compression bandage. This is like the quick clot stuff, so that if you need to put something on, something that's large and you're not going to be able to suture it until you get to other help, it's very helpful to have.
It's a large gashing open wound type situation.
Yeah, anything like that where you have a large amount of open tissue.
Okay.
There's also a triangular bandage, which you're familiar with, to make a sling out of.
Yep.
So if you have a small fracture or something, you can hike out with that in place. That's a bandana, and you can use it for multiple other things as well. There's alcohol swabs. There's also some 4x4s and smaller bandages, an emergency thermal blanket so that you don't go into shock.
Yep.
So those are all important things. Also bandage scissors, so that all of the bandages and things that it comes with, you can customize and cut to what you need to do. There's also what's important, there's a little marking pen, and this is when you put the tourniquet on, you put the time on there.
Oh.
Okay, it's good you can put a tourniquet on for up to 4 hours without any major problem. Because
4 hours?
Yep, people think if you put it on for more than 30 minutes, you got to loosen it or you'll lose the limb. That is not true.
Oh.
Okay, so it can be on for longer, but if you're getting to where there's paramedics or someone else, they're going to want to know what time you put it on. So This is important to put that on so that you document what it is. So this is the basic kit here.
Okay.
Any questions on any of the stuff I just ran through real fast?
I saw something that I didn't recognize. It was like a tube or something different.
That's in the deluxe kit. These 3 items over here, the standard kit has a splint, but it's a smaller rolled splint.
Okay.
The deluxe kit has a larger splint, which is a little bit more helpful for things like legs or elbows or something like that. This also has 2 chest seals in it, which is basically for sucking chest wounds. And things that you would consider for this would be if you're in a tree stand, you fall out and you get a stick in your side. If you don't get that sealed up, you will probably die. So it's important, especially if you're by yourself or you're miles away, you're going to need to put something on that to seal it. Same thing with a gunshot wound or something like that, or a bow and arrow, arrow wound.
That's a really interesting point, Dr. Fabian, because I think a lot of guys like me, a lot of 2A guys have an IFAK, and they keep it with them when they go to the range or they're going to a competition, but really should keep it with you all the time, shouldn't you?
I think so, and especially if you're out hunting. If you're more than a few minutes from first aid or from a phone where emergency personnel can get to you, you may need to have this on for an hour or so, and it's the difference between you not breathing and you making it through. The last thing that you noticed that was odd.
That's what I was wondering about.
Okay, this is a nasopharyngeal airway, and what this is something, if somebody's got a lot of blood in their mouth or something like that, you put it in the nose and it goes down to the back so that you can breathe through the nose.
Okay.
And it gives you also, if you're doing, for God forbid, you're doing CPR on somebody, it allows you to have an airway. A lot of people don't do mouth to mouth anymore, but it gives you an option to get some air in.
Okay, so the emergency advanced trauma kit, and that's all this stuff along with these items as well. So I see different colors. It's all the same items, just some different stuff. And you brought up something very interesting. This one, for instance, has sort of hook and loop on the back, so that if you have plate carrier, a backpack, a sling bag, something with Velcro, you can stick it on somewhere, and it's right there with you. And we have MOLLE attachment there as well, so you can use the MOLLE attachments to attach it to yourself. And what good is it if you don't have it, right?
Correct. I wish is not going to cut it.
Yeah, it's like a lot of people say, well, I've got my concealed carry license, but it's out there in the truck, or it doesn't help you if you do not have it. So in your opinion, what do you think about this as far as what's included in this kit?
This is a reasonable kit for the money. It's not completely comprehensive, but like you said, for most things, you're fairly close to emergency care. And so to hold things off until paramedics can get there, it's very good. Okay.
Right. So obviously we're going to include information for you guys so you can go and look at the entire review. We have all these different categories. We give them numbers, we give them weight, and you can see that in the description of this video. And I want to remind everybody where they can find this. This is EVERLIT Survival, and you can find them online at everlitsurvival.com. Yes. Any parting comments about this kit, Doc?
I think that it's reasonable for the money, and I think it needs to be personalized to what you feel you need to have. I think it's important as a starting point for people to look at the website, because we've also talked about antibiotics and some other things for preparation. And if nothing else, we live in Florida, we have hurricanes, we have floods and all of those sorts of things. And these are good items. If the emergency personnel can't get to you for hours or potentially days, you have something where you can survive and make it through.
Yep. You know what else this reminds me of? I need to update my personal training on how to use this first aid stuff. It's time for me to take some more classes. And I guess there are new techniques and things on occasion that instructors want to teach. Yourself as a medical professional, I'm sure that you probably agree with that. Get training, train often, have this stuff, carry it with you so you know how to use it. Don't forget, guys, check it out at everlitsurvival.com. And it's the EVERLIT Survival Emergency Advanced Trauma Kit. Thank you for explaining all this to me. I appreciate it.
My pleasure. Thanks for having me yet again.
You bet.